Hello, doctors, students, and lovers of homeopathy. Today is the 1771 day of uninterrupted daily webinar of International Forum of Promoting Homeopathy. We will start this session with a silent prayer. Thank you, everyone. So, IFPH is conducting uninterrupted 3 sessions every day from 7:30 to 10:30 p.m. The recording of the session is getting uploaded on the very next day so that who missed the session can watch it. And also, you can subscribe the channel without paying any money. So today's our guest and speaker is Dr. Jessica Monteiro. She is an associate professor of Department of Medicine of KLE Homeopathic Medical College, Belagavi. She is having around 14 years of experience in homeopathic consultation and more than 11 years of teaching experience in homeopathic medical college. Dr. Jessica has a very impressive academic background. She has completed the BHMS and MD in Organon of Medicine and Homeopathic Philosophy from AM Sheikh Homeopathic Medical College, Belagavi, and she has completed her MSc in Psychology. Along with that, she has completed a certificate course in food and nutrition and also an intensive course in research methodology and biostatistics from KLE Academy of Higher Education and Research, Belagavi. She has been a part of the curriculum redesigning for a BHMS course conducted by Rajiv Gandhi University of Health Science, Bangalore in 2014. Presently, she is the member of the Committee for Collaboration and Community of the Research Cell of KLE Academy of Higher Education and Research, Belagavi. Uh, she is also the principal investigator for the an in vitro research, that is effect of Calendula officinalis in wound healing, a cell culture study, and a integrated funded study on the efficacy of an integrated approach of both homeopathy and Ayurveda for hair fall. Presently, she is working on 4 educational research projects as a principal investigator. She has been a resource person at pre-conference workshop on the topic transforming healthcare with AI, driven precision and efficiency at Manipal Academy of Higher Education, Manipal in October 2024. And she has been also a resource person for the guest lecture on the topic mind and body health and menstrual hygiene at various schools in Belagavi. She has also presented a paper at international conference on interprofessional educational practice and care at Malaysia on HB education and interprofessional approach in the year 2023. She has presented more than 10 research papers on oral and poster presentation at various national and international conference. Now, today she is presenting on the topic application of qualitative research in homeopathy. Now, on behalf of IFPH, I proudly welcome Dr. Jessica Monteiro and request her to begin the session and share her knowledge with us. Over to you, madam. Please begin your session.
Thank you, madam. Am I audible to the audience?
Yes, ma'am.
Yeah, thank you so much for that elaborate introduction and welcome. I welcome all our participants to another session, and I'm so happy. Normally, I'm very happy to come back to this forum and meet all of you. I think I've become a regular a person in meeting all of you, and it really makes me very happy. I will start with my presentation. The topic I chose today is something very different from the routine topics which we use, that is application of qualitative research in homeopathy. And of course, the if I see at the delegates and the participants who are there in this session, I think it's all the senior staff, and I know that's not going to be really so applicable to them. They would not be interested, but the world today, the homeopathic world today needs research, because all of us are looking towards evidence-based medicine. And the the junior homeopaths or the students are now focusing, the Council of Homeopathy is focusing on research. But I feel when the seniors use their knowledge, their experience, and provide an evidence, this process of providing evidence of research to the world becomes more easy. So I thought, let me share a little about how easier it can be when we start documenting, because all of us do research. Our process of case taking is a part of research. When I understood the difference between research and our consultation in homeopathy, I felt that it is almost the same. There is nothing new we are doing. Only we need to know how systematic it is and follow a little more systematic steps, and here we are doing research. So I thought, let me just share so that next time when all seniors, when they are back in their clinic, if they just start documenting things in a more systematic way and start publishing it, I think the gap which is there suddenly starts filling in and this lacune is a little more reduced. So let me start with that. That's the reason I chose the topic. Just to start with it, what is research? Like everybody knows, research is a systematic investigation to establish facts which are there. So it's just whatever we are doing. If when we do it a little more systematically, things become more easier. So that is what research is. Just a minute. So research is a process to discover new knowledge, to find new answers to one question. It is again, the word, it comes from re and search. So whatever is already available, we are just trying to search it. We are trying to add new questions. We are trying to ask new questions, find new answers, and put up that information into the world into a systematic way. So that is research. And I think as homeopathic consultants, all of us need to take up some kind of research so that we are in a position to provide the evidence the world is looking with towards homeopathy. So basically, there are two types of research. One is quantitative research and qualitative research. Quantitative research is something like all of us are doing. We are trying to find figures, we are trying to quantify, we are trying to measure in terms of quantity. So we are trying to find the answers. If Naxwamika is efficacious, how much it is efficacious. When we are quantifying that, it becomes a quantitative research where most of them are focusing on. The students in the colleges are all most of the time doing quantitative research. But there's another type of research called as qualitative research, and that is what I am going to talk today. Qualitative research is a type of research that explores and provides deep meaning into the real world problems. Here we ask questions of why, how, when, where. This is something what we do in our case taking. When a patient comes to us, we are asking them why it happened, how it happened, when it happened, and then we are trying to find an answer for that. So this is so similar to what we are doing in our homeopathic OPDs when we are consulting. That's almost same what we are doing in qualitative research, but we have a question there. We ask a question there, we design the process, we know what are the questions we are asking, and then we ask them, we go into the problem, we try to interview them, we try to go into the depth of the problem with real world meaning and use these questions why, when, how, and come out with some answers to our questions which we set at the initial stage of starting this research. So this is what is qualitative and quantitative. In quantitative, we go into the real world deep meaning. And that's exactly what we are doing in our homeopathic case taking. In qualitative approach, it allows the participants themselves to explain how it happened, why it happened, what they were thinking, what they were feeling, what they were experiencing. So the participant is the one who is drawing your attention, who is giving you the answers already to your question. So you have to just analyze it. And that's so similar again. What we are doing in our case taking is we are asking the questions to whatever is our case taking format. We are waiting for their answers. We are asking them to explain how they are feeling, why they are feeling. And finally, we are drawing analysis from our interaction. So when we are talking about this interaction, this process of finding out the deeper meaning to our questions, there are different types of qualitative research. I will just quickly go into all of them and see how we can try to use them in our consultation rooms, how we can make it more easier, more scientific. What we are doing, make it a little more scientific and provide a evidence to the world. So ethnography is one of the type of qualitative research: grounded theory, phenomenology, narrative, and case study. There are many more, but these are the common ones which we can use in our uh, homeopathy. We can use that, but out of these also we cannot use ethnography, but grounded and the other things we can use. I'll just go quickly into what each one means. Now, ethnographic studies involve the collection and analysis of data about cultural groups. The researcher frequently lives with the people and becomes a part of their culture. The researcher explores with the people their rituals and customs. So ethnography is trying to understand a particular community, a particular area of problem. Maybe in our homeopathy, if you want to just find out some remedies for some kind of epidemic, we go into the area of epidemic. We try to understand what is the genus epidemis. We live with those people who are experiencing that, and then we try to understand that. But ethnography is more related to cultural. It was origin when people wanted to study in sociology, in histological studies, in history. People wanted to study certain groups, certain ethnic groups. So the researchers used to go with them, stay with them, and understand their problems. So this is ethnography. It is ethnic groups when we are trying to understand. So maybe when we want to understand a particular type of disease in a particular tribal people, in a particular community, we go, we understand their life, we understand their culture, and then we draw conclusions from that. This is not a very easy one to follow in a routine homeopathic practice, but this is what is a type of qualitative research. Next is grounded research. Now, or grounded theory. In grounded theory, it was, of course, developed by two sociologists, Glasser and Strauss. Now, this is one of, again, a common type of research which we use. Grounded theories are studies in which data are collected and analyzed, and then a theory is developed that is grounded in the data. So it is an excellent process for understanding the process through which the patient learn how to manage new or chronic health problems. Now, when we are taking a case, apart from our case taking, if we are using certain techniques to reduce their stress, or if the patient is themselves coming and saying that I am using so and so routine and this has helped me. So from the data what you collect, if you are coming out with a new theory, if that is helping people and that can be replicated, that is called as a grounded theory. So all the data we collect from our case taking, and if it is allowing us to develop a new theory from that, it could be just like, following a process, like, or maybe in potencies in homeopathic, if you are using a water dose and you are asking the patient, maybe comes out he uses a different technique of taking a homeopathic medicine, which probably was he did not understand, or you wanted to try something, and out of all these data which you have collected, you come out with a new theory of using a particular way. It could be using yoga during with along with your homeopathic medicines, or it could be using some other dietic techniques, all these things. Of course, Dr. Hanneman has also said along with this, when you use some other ways, you can enhance your results of the patients. So in these ways, you can just come out with the data, come out with a new theory from the data which you are getting from your patients. So this is called as grounded theory, where the theory is grounded within the data what the patient is giving you. So this is another very important type of qualitative research. Next is phenomenology. Now, what is phenomenology? Phenomenology is the study of the meaning of the phenomena or the study of a particular event. Phenomenology looks to investigate experiences from the individual's perspective. Now, normally when we are going into ailments from, we are going into the mental history, patient come out with so many experiences. They come out and say that I developed, like for example, a CPR patient has developed indifference from a particular phenomena which they have gone through. So when we develop a phenomena or a meaning out of an experience what the patient has, now this cannot be only from one person. When the similar meaning is coming out from multiple patients, and then you say that this is what is the data what we have derived now. Now Dr. Hanneman and all our stalwarts have already done this, but we need to again verify them and publish. Now, when you are taking, you have 10 patients whom you have given sepia, and out of their mental symptoms, out of certain phenomena, you felt that this has given rise to sepia. Because of this event, this phenomena, this was how the patient reacted, and that is how you have come to this kind of data you have come. This is the analysis, and this is why, this is how it has happened. So if there is a logical understanding, and this is done with a series of patients, and you come out with the same kind of logical analysis, you can call it as phenomenology. From a phenomena, normally we can use this for ailments from, when they have experienced some kind of a particular phenomena in their life, some kind of experience in their life, and that has led to some kind of ailments, and then you have applied those ailments, you have tried to use some remedies, and then the same thing have been replicated in a number of patients. That becomes your research evidence, and you can say for this phenomena this has been given, and this is the data analysis. This is so easy of what we are already doing. We just need to document it in a very logical way. So this is phenomenology. So we have come out with ethnography, that is something we are understanding about the culture. Then we have grounded theory, where from the theory you are coming, from the data you are coming with the theory. And now we have studied about phenomenology, is understanding the phenomena, the lived experiences of the patient, and then you are coming to a data analysis. Now, how is this different from grounded theory? Grounded theory is you take the data from people who have experienced this, people who have seen people experiencing it. Maybe the family members give some their view, the family members add on their experience, and then they come out with the variation, what has happened to the patient. So in grounded theory, the data is collected from many sources. So in our case taking, if we are collecting data from the family members, your observation, and then from the patient, that becomes a grounded theory. In phenomenology, only the patient's experiences you are taking and analyzing. So that becomes phenomenology, how you are trying to research when you are taking the case in your clinics. Next is narrative research, and this is something so much that we are doing every day in and out. The patient comes in front of us, he narrates his symptoms, he narrates like a story. He goes on telling what has happened, his childhood trauma, his past experiences, his present experiences, his environment, why he's feeling. So he's telling a story. Sometimes when we are going into constitutional remedies, when we are understanding the constitution of our patient, we start from the history, right from sometimes during the conception, the pregnancy history is also taken. So the narration, how the story has come up, and then we come out into the core of the remedy. So when we are using constitution remedies, our way of understanding constitution remedies from what the patient is narrating, their stories, that is becoming narrative research. You are taking the narration of the story, understanding what the patient has lived with, and then you come out with a kind of data analysis. So this is called as narrative research. So again, when you are going into in-depth, you're going into understanding the constitution of the remedy, and they are coming out with particular stories. But that is not limited to one. You are doing it in series of patients. When you're doing qualitative research, you keep on doing it when the same data starts repeating it. So for example, I can give you same, let us go to the example of sepia. When the patient experiences a kind of indifference, or she is not able to love her loved ones whom she used to love the most. When 10 people say that this indifference has caused me not to give back the same love. Now I feel indifferent because I do not get that love. I feel that I am not respected. All that I have done now is not enough for me, or I feel left out. And that is why I have developed this kind of indifference. If repeatedly 10 people or 20 people who are you are trying to examine in sepia and come out with the same symptoms, now you know that there is a saturation. And in qualitative data, 15 to 20 sample size is something which is more than enough, where the same thing starts coming up. So this is called as narrative research. Then we have case study researches. In case study, again, it may be a single individual who comes out with, this is what exactly what Dr. Hahnemann has done it. He has first taken a particular case, then he has done it to a group of people and derived the data, and then he has analyzed it. So most of the research, what has been done by Dr. Hahnemann, is a qualitative data research where he has understood the phenomena, understood their narration, understood why it is happening, and then analyzed it and given us the materia medica. So again, when we want to re-investigate with our present day surrounding, when we want to now provide an evidence to the world, we can research of what has already been done and give the world what evidence they want. So this is a case study research where there is in-depth analysis of a specific case. It could be you take a group of patients, you take an individual, you take an event of why it is occurring. So all these fall under case study research of qualitative research. And this is again so similar to how we are taking individual cases in our clinics. But again, it has to follow a logical way of understanding. I'm just today trying to say that doing research is not very difficult. What we are doing in our clinics, if we just apply some systematic approach to it, it becomes a qualitative study. We analyze it and we publish. And that is how we have so much of data with us that has to be just revisited, reanalyzed, and published to the world. So this is what I'm trying to bring an awareness in this webinar today. I'm not here to tell how to do it, why to do it. I'm just here to say that we are doing it. We just need to bring a change in our perception that yes, all of us can do research already in the setup where we are in our consultation rooms. That is the only aim of me telling you how we can apply qualitative research in our homeopathic practice of day to day. Now, how do we collect? So these are the different types of research. We have ethnography, you have narration, you have case study, you have grounded theory, you have phenomenology, different types with the same aim, but a different approach. Now, how do you collect the data? When you are doing this qualitative research, we normally do interviews. So interviews could be a semi-structured interview where you just give an open-ended question and you go on asking the patient. Whenever they are deviating, you just put certain questions and you bring back the patient the question and they answer. Similar of what Dr. Hahnemann has asked us to ask in their case taking. So one is a semi-structured and one is a proper structure. So again, we are also following a structured interview pattern in our case taking, where we start with the preliminary data. We start with the past history, the family history, the mentals. So we have a structured way of understanding our data. Then you have interviews. It could be an in-depth interview where you are going into the depth of everything. Then you have focus group interview where you have 4 or 6 people who come and they share their similar experiences. They discuss their experiences and share. For example, if you are proving a drug or you are doing this on a particular group of patients, you call them together and you ask them questions. There is a dialogue and understanding and discussion with 4 or 6 people, with one person, the interviewer, leading them the questions. Then you have observation. What we observe, we write that. Again, the similar thing what we do in our case taking, we observe, we use that data. So when we are analyzing the data, we write it, what was observed, how the patient was behaving, how he was saying. So we have a combination of observation and the patient's perspective. And documents is something where we have so many case papers in our clinics. We just take all those documents, we find a similar pattern, and then we come out with a theory, or we come out with the analysis of those case papers which we have already in our clinics. So these are the different ways where we can collect the data. How do we analyze the data? There is an inductive approach and deductive approach. Inductive approach is you are understanding and you are deriving a new theory from a similar, you are coming to a generalistic. Deductive is you already have those generals and you are coming to a, so deductive is already you know something. For example, you know like Nux vomica, pulsatilla, all these are arsenic, all these are fastidious. So you are proving fastidiousness. You're trying to analyze something which you already know. So you take their case and you say that I want to prove and revalidate that people of arsenic have fastidiousness. So you are searching for the word fastidiousness in all these arsenic people. So you already have a understanding about what is there, and you're trying to fill in, you're trying to research whether that is really present. Does all the arsenic people have fastidiousness? And if yes, what is the intensity? In inductive, you are just finding out, already you know whatever is there in a materia medica, but is there something new which we do not know? Is there an evolution where some new symptoms which were not recorded are being recorded according to you, and then you are seeing it in multiple people? So inductive is the data gives you a new theory or something new you are getting from it. Deductive is already you have known something, you are again verifying it. Apart from this, the analysis would be thematic analysis. Is there a particular theme which is coming out? Is fastidiousness coming out in all the arsenic patients, or in a group of remedies is fastidiousness or ambitiousness coming out? Content analysis. You're again having a content, the whole thing you are trying to understand, the content of the data you're trying to analyze. And discourse analysis. Discourse analysis is in context, why it is said. Again, Sepia developed indifference because she felt not loved. So this indifference because there was a particular cause for it. So you are trying to analyze the data with the surrounding. So all these things are different type of analysis. So this is something which we already do, but again, we are trying to use some systematic way of how to analyze these data. Now, why is it so much applicable in homeopathy? The approach is focused on understanding experiences, perspectives, and meanings. All that we are doing, we are trying to understand the patient's experience. We are trying to understand their perspective. We are trying to derive it. Homeopathy's inherent individualistic and holistic approach exactly aligns with what qualitative inquiry is. The modern medicine, or everybody who is doing qualitative research out in the world, they are trying to individualize, find a holistic view of what the people are experiencing, and we are already doing it. So it so much aligns with what homeopathic principles are. It helps us to understand how and why behind the patient experience and treatment outcomes. Why the patient has experienced, why the suppression of grief in Staphylococcus aureus has come out with in a particular way. So how suppression in Staphylococcus aureus is different and natrium mur is different. So we are trying to understand the reason behind it. And then why did we prescribe Staphylococcus aureus? Why did we prescribe natrium mur? Our treatment outcomes, the logic behind that, when we analytically and logically put it, it becomes again a qualitative research. It helps us in a decision-making process. So why did we reach that particular remedy? When we put all these things together in a document, it helps the next generation to understand what was the process in which you came to that decision of finding that particular simillimum. Otherwise, everybody has our own way of coming to a simillimum. But if we are able to put it into a document, maybe our next generations are able to understand easily why, what was the logic. So it adds on to the already present data. Already what is present, it adds how we are doing it in our present day world. Understanding the art and clinical reason behind individualizing prescribing. So basically, we all have a different way of individualizing. When you document it and you tell the process to the world why you did it, it basically helps people use that and replicate that process. It identifies patterns and themes and helps people to go on with the investigation. So basically, qualitative research is combining what is already there in our literature for homeopathy, adding on to what is there, and showing a path to the next generation or to the juniors how it can be done in a logical way, so that most of us are able to find the same simillimum for the same patient. Otherwise, most one patient having the same disease pattern or symptoms, by 10 homeopaths, they come out with 10 different remedies. Probably when we start documenting it, we start having a logical approach. What we already do, when we start documenting it and publishing it to the world, I think this lacunae, this gap of having so many variations would to a larger extent be reduced for the homeopathic world. And for the world around or world out there, we are giving the evidence of what they require, of evidence-based understanding of homeopathy, what the world is waiting for. So this is all that I wanted to bring about, an awareness of how we can so easily apply qualitative research in our day-to-day homeopathic consultation. So thank you so much for that patient hearing from all of you. Thank you.
It's time for discussion. Those who would like to participate, please raise your hand, because we all know that everybody is complaining that we don't have enough research studies and works. But unfortunately, what happens is that majority of our physicians are not at all paying attention to this much important topic. And of course, Dr. Jessica is really successful in presenting beautifully the topic. And it's up to the persons who are listening the program to add something, and you can clear your doubts, please. Well, Dr. Jessica, what about the possibilities of conducting such studies and how far it is effective in our institutions? This
Of course,
qualitative
it
analysis.
is. It is as you have to follow the process, because I am working on a couple of qualitative research, which I am already publishing. So you have to have an ethical clearance, and from your, because you are involving human participants, and you have to have structured questions, which we already have. Depends on what you want to find out. If you want to know the mental symptoms of a particular drug, you formulate a question and you go ahead with either an in-depth interview. You want to, it's how you formulate your questions. So it's very feasible. It's very feasible, but it's time consuming. But when we align that with our day-to-day practice, it's really easy. That's what awareness I want to bring. We do not have to go around in the world saying that I want to do research, I want to do research. When you're already taking your patients, when you are consulting, you just need to take a consent from their patients, have an ethical approval. And what you are doing, you just put it into a research perspective, do a systematic study, and use a logical data analysis. So that's very much feasible.
So an ethical committee is a must, and it should clear all these formalities, isn't it?
Ethical clearance is something when you want to publish, because these are the parameters which they look out. But that's okay. That's in process which just takes a day. You have to just submit an application saying this is the study I need to do. And they will give you, they have a certain protocol, and you need to get a clearance, because when you are doing research and when you're using human subjects, getting an ethical approval is only very important, and only then your studies will be published.
Yes, of course. What about the publications in your colleges?
Of course, we are all, because there is a lot of lacunae, and the authorities associated with homeopathy are now focusing. I think the whole medical world is focusing on research. We are all gearing up, and I think we are all focusing on getting research done.
Yes, definitely some sort of monetary problems also there. Who is to give enough support, financial support to these publications as well as studies?
No, when
Unfortunately,
we
now
start working, sir, I feel when we start working and we start having our, it's like, not one person. When all of us start doing, things will start falling in place, I guess.
yes, but of course, definitely in the allopathy, there are pharma companies for a particular purpose they are doing for making a product for the this market. They are doing conducting business research works and they publish it, and everyone will accept that whether it is effective or not. But we don't have such facilities, such methodologies. So that is a major limitation, I think, in homeopathy.
Yes, sir, that's definitely a limitation, but that's why I said in qualitative research, only 10 to 15 patients if you interview, that is more than enough. And I think in a month, we all the senior homeopaths, we do see enough of patients where we can analyze the data. So why I just chose qualitative is like quantitative, we do not have to have a large sample. You do not have to use some kind of preparations. Already what you have, what you are doing, that can be you can easily merge in your research perspective to what you are already doing. And that is why it is so much applicable in homeopathy. So basically, I said qualitative research is so much aligning with what we are already doing. So to start with, we can start with qualitative research without so many limitations that we look for.
Yes. How far this is applicable? These are applying in our colleges as well as institutions. In your opinion, we have the national institutions and central research institutions are there. How far? What about the statistics? Any statistics regarding this research works?
No, that's what we do not need any statistic analysis for this. All the data which we have, when we analyze it according to the themes, according to the data only gives you the answer about what the patient said, how the patient said, whether he's feeling fastidious was the symptom, grief was the reason for him. All those things, when you underline and you draw those analysis from your data, that becomes your data. You do not need any statistical analysis for qualitative research.
No, no,
That's
no.
why I
I am
was
no, 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 no. I am not mentioning about the statistical analysis, but regarding the quantity of work doing for this medical research in homeopathy, do you have any statistics? How much work they are doing? How many publications? That's why I am asking about it.
Yes, sir. Everybody, that's what I said. No, there is now a kind of stimulation which all of us are, and everybody is started working on it. Of course, in the institutions, all are doing. But when we are so many practitioners, India has the largest practitioners of homeopathy. When all the practitioners start applying that with this, can I find a logical answer to what I am already doing and start documenting that, and maybe we can come out with a large data. So that's what,
Yes.
when everybody join hands, I think that becomes more easier.
Definitely, we need a publication division in our all colleges, and those who are experienced in there should guide our beloved students and teachers in that way. Otherwise, it will not flourish, I think.
Yes, sir.
Yes. Yes. Now it's time for discussion. Those who would like to participate, our seniors are there. I think Ram Parvesh sir is there, sir. What is your opinion? Ram Parvesh sir, are you there? Please unmute, sir. Unfortunately, he's not responding. Dr. Sanesh, are you there? So, in your opinion, which one type, whether the quantitative or qualitative, which is more practical and more acceptable as far as homeopathy is concerned? Dr. Jessica, what is your opinion?
Yes, sir. Can I get a repeat question?
Yes, yes, of course. This type of study is effective or practical or
Of course, yeah.
acceptable?
Of course, the qualitative research is very much practical because
Yes.
out of my experience, I have conducted a couple of qualitative studies and it is very much possible, sir.
Who funded for your studies?
Sir, I have not taken any funding because I did a research on I wanted to see what are the communication challenges the homeopaths faced. So I went to around 10 to 15 homeopaths. I had a structured question. I asked them what are the communication challenges you are facing. I noted down all their answers and I derived the analysis from their answers. So I only needed to spend my time.
I think the National Council must invest on that definitely, because we
Of
know
course,
that
the
a lot of
National Council has some fundings, but
yes,
at my level, that's what you need to. Qualitative is all about giving time, understanding. So practitioners need not go. Patients come to them. So you can conduct a qualitative study. That is what I'm trying to re-emphasize.
yes, of course. Dr. Dhanesh,
Yes,
welcome. Yes, please continue.
Dr. Jessica, it's really a very good session indeed. And we must appreciate you. We really appreciate you on such a different subject, taking such a different subject for this session. And homeopathic research is one of the area where homeopathic doctors are not touching in a good way. But now things have changed a lot since the formation of CCRH, and nowadays we people are able to give answers to the queries posed by the people from the other side. And actually, the research, the only difference what I would like to see is that the homeopathic protocol is somewhat similar to the allopathic protocol. So that need to be changed because
Very true.
our system is a man-oriented. That means a person-oriented, or just like a homeopathic doctor-oriented. Otherwise, we can say the person-specific. So the protocol.
Actually, can I add something? Those
Yes.
differences become more practically challenging when we are doing quantitative research. But qualitative research is more feasible in homeopathy. And I see, like, we senior, like, people who are more into more years of practice, seniors, they feel that maybe research is not what I can do. So if we start bringing in that awareness that it's not so difficult, all of us have done it. We have so many hundreds of documents in our clinic. You can just analyze it. You have students, if you give those documents for them to analyzing, that becomes their own research in itself. So qualitative research is more feasible. That is my personal perspective, actually.
Yes, exactly. But the thing is that most of the doctors are sitting in the clinic and they are always busy with the patients, and they are not bothered about putting up all these things together and make an assessment of that. But instead, they have their own assessment of, for example, if a person is treating this dengue fever, he may have his own protocol, and he may have some medicines working in a better way. But he didn't collect the data, and he didn't enter his data and find out which medicine is more suitable for him accordingly. But
So, for example, when you said that they have a particular protocol of treating it, if they have done it for 10 patients, that's exactly what I'm saying, that we need to publish it and tell to the world, this is what I follow. And
yes,
people
yes,
can follow it.
yes, exactly that we need to publish, but still people are not, most of the doctors are shy and they are not coming forward for that. Even they are not even able to write an article in a magazine, or they are not coming forward to present something in front of audience, public audience, so that if those people who are having now very good practice, they start writing, then they start lecturing. Definitely, more and more people will watch it, and they will share their views on that talk.
Maybe my
Unfortunately,
suggestion would be in the institution level, maybe research trainings are be given. Maybe for the practitioners, some CMEs and all can be done on research so that it will help them. Probably that could be
but
one way of finding a solution.
But there are CMEs everywhere. We have more than thousands of the CMEs in Kerala. But the thing is that people coming over there and sitting over there and talking, and they are sharing their experience, but they never bother about all these publishing things. They may come just like a family get together. They are coming over and talking with one to one, and they are sharing their memories like that. But instead of, they are not concentrating on the specific subject to be discussed. That's need to be changed. And we need more and more publication from different people from different side also. Unfortunately, this is not. Doctor, I have a question to you. What kind of support you get from your government of Karnataka on homeopathic research and studies and homeopathic government? How many government dispensaries? How many doctors are in government profession? And what kind of
Sir,
situation?
I come from a academic background, so
Yes, I know, but being a person, this is the biggest problem as far as we are chasing, because those people sitting in academic, they are always sitting and talking about academic only. They are not bothered about what kind of practice is going outside, what is the situation for the children, whether the students coming out of the college will get a job outside, inside the state itself. So
correct.
that need to be discussed inside the college, not outside the college. This
Very
is,
true, sir.
but frankly, associations are discussing that we will bring maximum number of hospitals, we will bring a maximum number of these dispensaries for juniors. But how many of them are sincerely working for that? For example, in Kerala, our associations are working very hard for that, and most of the senior doctors have persons from patients from the political side, and they really motivate them to start dispensaries. And as a result, we have more than thousands of homeopathic dispensaries in 1,000 dispensaries in Kerala, with more than 40 hospitals. District hospital is more than 20 beds each, and there are big hospitals in district level, taluk level, and so. So if the same situation happens in India, almost everywhere, things will be different. Most of the doctors, our juniors doctors will get confidence, and they can do a very good chance of winning more income from that, as well as they can treat patients with low cost. So we need to take a research on that side also.
I agree, sir. I agree.
How many students are getting job from this, and how many people are stick on with homeopathic practice after getting out of the college? So this need to be discussed in the college meetings, and you will have to get contact with the students also to motivate the students. Then students will naturally come up, and if the students can start a rebellion for that, definitely they can win. This is what we have done. For example, myself itself was jailed for about 20 days, 15 days in the central jail of Kerala, Trivandrum, for a strike for starting degree courses in our college. So how many of the students are willing to take such challenges? Only those people who take such challenges can win the game. So this is what I would like to add to the session, and what kind of research need to be done. So we will have to think in different aspects. Research can done in all. That's why we can see that in the very recent there was an editorial in Indian Express some 3 to 4 days back about COVID vaccine, because the COVID vaccine, according to the ICMR, is effective according to them only. But doctors and other researchers from North Korea, England, UK have come up that this can produce more damage than good. They have specifically said that it can produce a certain kind of myocardial infarction, myocarditis, and there can be big blocks anywhere in the blood circulation. I like that. As a homeopath, for example, to my assessment, I can say that it's a research, maybe a research work without paperwork. I can say, because that is that, as we all know that when the COVID has arrived, at first there was homeopathic medicine, arsenic album was given to everyone. The number of patients were less, and the number of admission was less, number of deaths was also very few. But once the vaccine had come out, the number of patients increased. As I said, those who took vaccination came up with the COVID positive, and then the people around them also get COVID positive, and that was the first. That was the first COVID wave, and the second time when it has happened, and the second vaccine was given, and the same thing is repeated, and that was the second wave. So actually, these two waves were produced by the vaccine, not by the real COVID. So this kind of research need to be published, and we will have to take these things to the people, as well as not to be. If we make a research on every ward, we can find that a number of patients who are suffering from cardiac problems as well as this stroke are more nowadays rather than the pre-COVID era, not area, pre-COVID era. So according to them, they may say that, oh, it is because of COVID. Actually, it is not because of the COVID, but it is because of the COVID vaccine. There is a very wider chance for discussion, wider chance for research in all these things. And if homeopathic doctors community, if the homeopathic doctors community come up with such research, that will definitely a big challenge to the ICMR itself. Unfortunately, that is not happening. It's what our
Yes, of course, Dr. Tanesh. Let me add one thing. Well, we must remember about the Ken's quotation where he said about these things are used to cover up their, used as a cloak to cover up their scientific rascality. It was said by Kent. I don't think Dr. Jessica may remembering it. Well, almost all studies, the so-called studies, as well as research papers, were often published according to convenience, not according to the science. That's the most tragical thing in medical science, not in almost all parts of the world. That's why we often witness us. Certain medicines are banning, or certain untoward reactions are occurring even after successful study. Then again, in case of this COVID vaccine, they declared that the vaccine was effective in pregnant ladies in 4 months. How can you conduct such a study in 4 months? So nobody did question the veracity of such studies. Why? That's the question. Dr. Jessica.
Sir, that's what I said. No, because of this qualitative research, as of now, with homeopathic perspective, is a more feasible thing, where we are trying to understand why, how, we are trying to analyze the events, their perception, the meaning. We are trying to understand their thoughts. So we are trying more than quantifying things. We are trying to analyze. For example, if you have given the example of COVID, or this example of the research done in those pregnant ladies, apart from that, why it worked, why it did not work, or when we are trying to understand the perspective, the in-depth meaning, that becomes more easier and feasible. So that's what I said. We can start with qualitative and move on to quantitative, I think. Qualitative right now may be the answer.
Yes, that's most important. Qualitative studies needed, but what is needed is more publication, as well as we should develop
Qualitative studies are also equally published, sir, and they are of equal value as well. So there is no
whatever,
difference between
yes,
quantitative and qualitative.
whatever may be the method of study, we should have a culture of reading the journals.
Very true, sir. Very true. The culture of research, the culture of
Yes,
publication has to be important. Very true.
culture of thinking. You must ignite your minds, minds of students, as well as to influence them. Moreover, they had to develop a culture to read all these things, journals. But that was not happening in the last 50 years. That's the most tragical thing, I think. I hope.
The basic aim of this webinar is also to bring up that kind of awareness among all the practitioners, academics, all of them together have the same kind of perspective that becomes more easier. I think we all get aligned together then.
Yes, moreover, there is a kind of inhibition in almost all persons. They are not at all attending or listening or participating in discussions. That's very unfortunate. We are about to start the DM in homeopathy. The postgraduation is there, the PhD is there, now DM is there. But unfortunately, our people are not able to communicate effectively in forums like say IFPH. A lot of forums are there, a lot of discussions are there, but majority are keeping silence. I don't know what happened.
Actually, that kind of thinking need to be changed. And people should come out. I have learned as much of thing from homeopathy. So why can't I give something back to homeopathy? That kind of thought is
Awareness.
that kind of
Awareness is needed,
yes,
sir.
exactly. People should come. Doctors should come out openly, and they may get into the public, and they can interact with the public. They can motivate the public, and they can share their cases so that people will know what is happening with homeopathy in a
Yeah.
particular situation or particular disease or particular condition.
The first chapter, H.R. Roberts, what you can offer young man to homeopathy is the first question. First chapter is there in H.R. Roberts. That is most relevant still too, even after 100 years.
True, sir. True. Thank you for all your perspectives, sir. It has added to my perspective as well. So we had a good two-way learning from each other.
Yes, that's how homeopathy can grow. People's contributions from all part, whether it be a small doctor, a beginner, or a. But for example, in the coming week, we have a person who just has completed MD. I know, just BHMS, and he's a gold medalist. He's coming over here to make a presentation. So that kind of confidence in our younger generation. So we will have to look and motivate them to bring to take homeopathy to higher levels in the future. Anyway, I'm very happy to say lot of thanks to Dr. Jessica in this evening. And we have a very excellent presentation as well as a very good interactive session also. And congratulations, and hope we can have another session for
Yes, sir.
tomorrow for in the coming editions of our presentation.
Thank
I'm
you so much,
inviting
sir.
Dr. Sudhi Sariga to say a few words, and we can conclude then. Yes.
Thank you, sir. So first of all, I like to thanks and congratulate Dr. Jessica Monteiro, because this session was really very much engaging and very much informative session. I also did MPH in this. I know the protocols of this research work. So it's a really very scientific process to conduct any research, and to engage all the young practitioners, young students. So for their academic part in graduation level also, if they introduce a little bit, it will be more helpful to practice in such a way so that they can record the data in that way. That will help homeopathy also to grow more, and it will become more scientific method of treating patients, and it will streamline all this process, so we can come at the level of this modern medicine also. So this is very much engaging session, madam, and
Thank you,
it's
ma'am. Thank you.
thank you, ma'am. And it helps young practitioners also to think in this direction, and also uh, the discussion was also very much engaging. Yes, it is some challenges are there to streamline in this research work, and to understand all the research process, and to go through all the research process to getting ethical approval and all. So yes, we will together we will do hard work to make this homeopathy more scientific. More, it is scientific, but to make them understand this
Evidence-based.
yes,
Evidence-based.
yes, evidence based, more evidence based. We can do it together. Thank you so much, ma'am. Your inputs are very much valuable, and we can learn so much things from this. So thank you every participants also, and I hope that you will share more knowledge with us, and in coming sessions. Thank you, ma'am. Thank you, everyone.
Thank you. Thank you to all the participants for the patient listening.
Thank you,
So
Dr.
now,
Jessica.
yes, sir. So now
Okay.
I am handing over the session to Malayalam session. Thank
Okay.
you.
Okay, thank you.